Hello everyone, I have decided to keep my 9-month-old jumperoo. For authenticity, I thought I'm not going to pack it away for this video, so we move. So welcome back to your favourite series where we talk about fascinating medical conditions and celebrities who have them that you didn't know about. Over the last few weeks, we've spoken about Gigi Hadid, Selena Gomez and Kim Kardashian, and this week's topic is endometriosis and Molly-Mae. Just a reminder, if you do enjoy this video and this content, then I'd love for you to give the video a thumbs up. And if you're new to my channel, or if you are a viewer that hasn't yet clicked subscribe, I'd love for you to hit that red button and become a viewer of mine. So March is the awareness month for this medical condition. It is an underdiagnosed and often life-changing condition. So this is Sigmund Freud's couch, and this is where patients came with endometriosis-like symptoms and were often diagnosed with hysteria. There is now lots and lots of evidence to show that. Hysteria, which is now discredited and is an ancient mystery medical condition which was thought to have a psychological origin, is in fact endometriosis in most of the cases. And celebrities such as Molly-Mae has come out in the press to talk about how it affects her personally. And as a GP trainee who has an interest in women's health, I thought it was really important to make this video to not only educate you about the medical condition, but also to empower you in case you are dealing with this condition, suspect you have the condition, or know somebody that's close by that is suffering from these symptoms. Because 1 in 10 women and those that have a uterus have endometriosis. And did you know that it actually takes on average 7 to 8 years for a patient to be diagnosed? And when I explain the condition and the symptoms to you, you will know exactly why. So as we've said, endometriosis is a gynecological condition where we see deposits of the lining of the uterus appearing outside of the womb. So on things like the ovaries, the fallopian tubes, and just generally in the pelvic cavity. But interestingly, you can even find these deposits in the brain and the lung. And there are many theories that try to explain how this happens, which we'll get onto. So this condition is driven by our hormones, estrogen and progesterone. And as you may know, throughout the month, if you are having a normal menstrual cycle, which is a period, then these hormones fluctuate to cause bleeding, often once a month. So usually around the time of your period and a little bit before and after, these patients can have lots and lots of pelvic pain that can sometimes radiate into their thighs and their lower backs. And when I mean pain, it's not just your typical period pain. This pain can be debilitating, where it means the patient needs to take time off of work, and it eventually affects their quality of life and become very depressing for them. Some patients can actually have pain throughout their cycle. You can also have lots of heavy bleeding associated with this as well. And because these deposits of the lining of the womb can attach to other areas around the womb, such as the bladder and the bowels, and cause inflammation, it can cause things like pain when you're opening your bowel. In addition to this, if the patient is having penetrative sex, which is where something is entering the vagina, then this can cause a lot of pain as well. And Molly-Mae actually came out with this and said that she was suffering from painful sex, which in the medical world is called dyspareunia. And she spoke out about how she was having difficulties with Tommy, her partner, and how it was causing them issues in their relationship. In addition to this, because these deposits of the lining of the womb can cause inflammation, which can distort the anatomy of, say, for example, the tubes and the uterus, it can mean that patients can have difficulty falling pregnant because of these adhesions. So in the body, when there's an area that's inflamed, they become a little bit sticky. And when they become sticky, they attach to each other and cause adhesion. So they either sort of stay together, or if they do eventually pull apart, you have like a band of fibrous tissue between them. And if things are rubbing against them, such as your bowels, your uterus, your bladder, you can imagine how much pain this causes. As mentioned earlier, you can even find these deposits in the lungs, and it can mean that the patient can have a collapsed lung, cough up blood, and accumulate blood just outside of the lungs lining. So we said 1 in 10 women have endometriosis. So who is at risk of having this? Now, with everything in the medical world, there isn't usually one particular cause, and things are often a mixture of your genetics, which causes a predisposition to something, and your environment. And if these two are strong enough in one way or the other, then you get that medical condition. So genetic factors meaning that you inherit this from people in your family. So for example, if you know that your mum, your grandma, your sister suffer from this medical condition, then you are likely to carry that gene that makes you predisposed to it as well. But also the environmental factors that increase your risk of endometriosis is also things that we can't really control. So these are things like starting your periods at an early age, having shorter period cycles, so that overall in a year you end up having more periods on average, and having heavy periods that last longer than 7 days, because all of these mean that we are exposed to the hormones that drive endometriosis for a longer period of time. So the medical world has been pondering on the possible causes of endometriosis and have come up with 3 interesting theories. Theory number 1 is this called retrograde menstruation. So a lot of people feel that when we do have a period and that we shed the lining of our womb, some of that blood actually comes out through the fallopian tubes rather than going down into the vagina and out. And it is thought that this retrograde sort of flow of blood carries deposits of the lining of the womb, which then implant into the pelvic cavity and start to cause inflammation. There is a flaw, however, in this theory, because it doesn't really explain why those who haven't had periods yet can get endometriosis, such as babies and prepubescent girls. Also, doesn't really explain why we can get endometriosis in the brain or lungs. So we move on to theory number 2. It's called stem cells. It is thought that stem cells that come from our bone marrow and travel into the blood before they go on to areas of the body that they're meant to eventually grow into, accidentally get deposited in the wrong areas, such as the brain and the lung, and they start to mature and develop and become these endometriotic lesions. And theory number 3, called Molly-Mae. So early in our fetal life, when our body is deciding if we want to have a female or male anatomy, goes through some changes where certain parts of development get pulled down to become a uterus, to become ovaries and eggs. For example, did you know that babies who eventually become boys, the testicles are equivalent to the ovaries, and they are usually inside the body, and eventually they descend down into the testes. But if a baby is born premature, then this descent hasn't happened yet and can sometimes take some time and happen afterwards. So as I was saying, in this process where everything's sort of forming and going into place for what we would look like when we were born, it is thought that some cells become dislocated from this process and end up depositing in parts of the body as it's migrating down. So those are the theories behind it that are really interesting. But let's get back to today and what to do if you are suspecting that you have endometriosis. So the most important thing to do is approach your doctor and tell them all about your symptoms. And it's sometimes useful to keep a note of them, because when you're in the doctor's office and you feel like you're under a bit of time pressure because you've got an appointment, it's easy to forget all of the things that you thought you needed to say. Because like I said, things like painful sex or pain when opening your bowels can actually be related to endometriosis as well. So all of the symptoms that you feel like are happening around that particular time period or other time periods is really important. Your doctor will most likely examine your tummy and want to do an internal examination where they put 2 fingers into your vagina and have a feel of your pelvis. They will then likely refer you for an ultrasound investigation. Now, an ultrasound doesn't diagnose endometriosis and is often used to see if there are other causes for these symptoms that you're experiencing. And even if the ultrasound is clear, meaning that it hasn't spotted any issues, you can still have endometriosis. At this point, you'll most likely be referred to a gynecology team who will see you and assess your symptoms further. And the gold standard, which is the diagnostic method that we use to diagnose endometriosis conclusively, is laparoscopy, which is where they create small incisions into your tummy, pass through some tubes that have cameras on the end to have a look in your pelvis to see if we can actually see these deposits of endometriotic lesions. And in fact, Molly-Mae had discussed about how she had this surgery, and she showed her tummy and the scars that she had, and it was part of not only her diagnosis but also some of the treatment that she received. So how is this treated? Back in the days where we didn't have a great understanding of endometriosis, the treatment option for these patients was to remove their ovaries and their womb. And it was thought that that just got rid of the problem. And I'm really glad to say that we have a lot more options than that today. Treatment is broken down into 2 categories: medications and surgery. Now, the treatment options that the patients can choose is often dependent on if they want to conceive and have children, or if they feel like they don't want any children or have completed their family. Because if a patient is still willing to get pregnant and have children, then they are offered things like pain management to just manage the pain aspect of the condition, or have this keyhole surgery. So when they're going in to diagnose, if they see any endometriotic lesions, they can actually sort of burn them off with the end of another tool. Now, this isn't usually thought to increase the patient's chances of getting pregnant, but it's just another form of pain management to help keep on top of their condition. So, if the patient has completed their family or doesn't actually want kids at all, then the treatment options are going on the contraceptive pill or the progesterone-only pill to stabilize and keep their hormones at a level that doesn't trigger these endometriotic lesions. In a similar concept, they can also take medications that affect the release of gonadotropin, releasing hormones in the brain that stop that cascade of hormone fluctuation that is known to trigger. And last but not least, although it was one of the first methods of treating endometriosis, it is still something that is quite valid, and that is removing your uterus and your ovaries. So there you go. A whistle-stop tour on endometriosis. I'm glad to say we've come a long way from Sigmund Freud's couch and thinking that endometriosis is largely a psychological condition, and that we have a lot more treatment options for patients other than just removing their uterus and ovaries. Because there's lots of overlap with this condition and the symptoms with things like IBS and other medical problems, it takes clinicians and patients a lot of time to come to the conclusion that it's actually endometriosis, which is why it's very important as a doctor to educate my patients on the symptoms. So if they recognize any of them over a period of time, then I can take on those symptoms and refer you accordingly. I hope this has helped, guys. Don't forget to hit the thumbs up button and subscribe button if you want to see more. I'll see you next week. Bye. So there you go, a whistle-stop tour. So there you go, a whistle-stop tour. So there you go, a whistle-stop tour.